Hi and welcome to another episode of Coffee Chats with Toby. Today we're going to go through everybody's favorite muscle group and how to train it. We're going to look at the glutes. So I think it's really important before we kind of get delving deep into how exactly we get the most out of our glutes and how we effectively train the different glute muscles. I think it's important for us to really kind of get a grasp on what the glutes actually pertain to. So just like the word explains, glutes is not just one muscle, it's actually three different muscles. We have the glute maximus, the glute medius, and funnily enough, the glute minimus. Now for the purpose of today, I'm going to kind of delve into or zone in on the glute max and the glute med, because this is mostly the two glute muscles that people like to train, and we obviously get a huge amount of benefit from when it comes to sport and performance and all the rest of it. So one thing that I kind of really want to quickly address first is where these muscles are or where they pertain to, and how it is they react or work our body very differently. And for all those who are more focused on aesthetics, which there's absolutely no problem with at all, how exactly they look and where they are in terms of developing the shape of your glutes. So basically glute max is our biggest muscle, so it's got the biggest cross-sectional area in terms of muscles in the entire body, and it's the one that if you were to look at the behind of a person, it's the one that kind of rounds off in the middle. So we can get super personal here. I'm going to throw my bottom in front of the camera and give you a bit of an idea, but the glute max is this muscle here, so it's the one that kind of comes from the middle and kind of goes down and attaches to the back of our leg. Now, as that kind of looks, the way that, or the movement that the glute max is most involved with is what we call hip extension. Now, I want to make sure that we're super clear on what hip extension is, because this is an area where I find so many people fail to actually train the glutes. I hear time and time again people coming into the office, having a chat to our practitioners and going, look, I really want to work glutes, but I just can't activate them. They just don't want to activate, and I have real troubles activating them. Now, look, I understand that there are some genetic predispositions, and we're not going to go into that, but what I find is 9 times out of 10, the reason why people have so much troubles with this is, one, they don't know that glute max is most involved in hip extension, or two, they don't actually understand what hip extension is. So hip extension pertains to our leg, or our femur, going backwards, or extending going backwards in respect to our pelvis. So if you think about the hip joint, it is the leg going backwards. So if we have a look at the hip joint, it's the leg going backwards. If you can see that movement there on the screen, it's that going backwards movement. I know that sounds very simple, but where a lot of people fail is they don't really hone in on to the fact it's the hip socket and the leg going backwards, and they look at the entire hip region, so the entire pelvis. I'll give you a bit of a look. They look at the entire pelvis region and go, right, well, if I can get hip extension, that's hip extension. Well, really, that's not. It's actually a pelvic tilt movement, what we call an anterior pelvic tilt. And what this actually does is makes it even harder for us to achieve hip extension. So hopefully I can give you a little bit more of a look up. So what we're looking at is the angle here, and taking that angle backwards in that position there. So if we have a look at our hip's pointing straight down, and if you have a look at our leg is now going backwards. That's true hip extension. Now if I'm going to cause an anterior pelvic tilt, my angle of my hip is now going backwards, and therefore my leg in respect to my pelvis is actually not really in that extended position. So what happens when we get that anterior pelvic tilt is it becomes harder and harder for us to actually achieve an extension in our hip. Now I know I might have lost a few people here. I'm going to try again to kind of showcase this, but But what we also find is that that kind of whole concept around that anterior pelvic tilt and what that does then to our ability to get into hip extension is actually what causes so many people to really struggle to achieve glute activation or a greater level of glute activation. It's often why when people are trying to do glute exercise, they're actually involving more of their hamstrings, because hamstrings helps to increase anterior pelvic tilt as well, and not get that activation in their glutes. So it's really, really important when we're doing any kind of glute activation exercise that we're keeping that neutral pelvic tilt. A really, really, really easy way of doing that is to squeeze your bottom cheeks together like you've got a $50 note in there you don't want me to steal, and that helps to align your pelvis in a nice position. So I'll try and demonstrate that real quick. So in this position here, pretend I'm in an anterior pelvic tilt. If I squeeze my bottom cheeks together, what that does is it naturally tilts ourselves into that correct position, which means my pelvis is now facing down, and it's now really simple and easy to get into that extended hip position. Now this becomes really, really important as well when we start to look at people who struggle with their gait or the way that they walk. I see oftentimes people who have an increased time spent sitting, hip flexors get tight, hamstrings get tight, and therefore they're in an anterior pelvic tilt position, and then really, really struggle then to get their glutes to fire. So how it is, oftentimes this gets brought back to, so we look at tight muscles, underused muscles, but we also look at what movement pattern they may be doing in their everyday life that causes this. And oftentimes I feel that this is the way that people walk. So they don't walk with their pushing backwards into their big toe. They're actually walking forwards, creating more anterior pelvic tilt, and then more trouble activating their glutes. It's actually logical and not a coincidence that our glutes, being the biggest cross-sectional area muscle in our body, is designed for the way that we as humans are meant to move. Or locomote or get around the place, i.e. walking. So when we walk, we're actually designed to use our glutes to walk and push us forward. So in a neutral position, your pelvis is facing down, and every step is pushing back, using your glutes to drive you forward. So I hope that helps. It should also you should be now thinking about, all right, exercise in the gym. Again, so when I'm doing an exercise, all it is a movement made difficult. If I'm trying to use my glutes, what I really should be focusing is trying to get into that hip extended position. So is my pelvis in a neutral spinal curve to allow me to get into an extended position in my hips sooner or earlier on in a movement to get more activation of my glutes. So a perfect example is a glute bridge. I'll give you another example, hopefully, of a glute bridge. So glute bridge, typical one done by glutes. Oftentimes people feel it in their hamstrings, and oftentimes again, it's because they start to do a glute bridge like this. And as you can see, my hips are in an anterior pelvic tilt, pointing almost here, so that my legs are far from getting into an extended position, and my hamstrings are actually firing here. Whereas if I start the exercise by squeezing my glutes, making sure my hips are in that neutral position, and actually driving through my hips, you can see now my pelvis and my hips are getting into a far more extended position, and therefore activating and utilizing my glutes a whole bunch more, glute max a whole bunch more in that exercise. Same goes with a hip thrust, same goes with a squat, everything, it doesn't change. The concept is the glute max is designed to hip extend, and the more we get into hip extension, the more the glutes become active. So I hope that really helps in terms of the glute max side of things. The glute med, which is actually in our side pocket, it's this muscle that sits here more on our side and kind of creates that shape that when we're talking aesthetics, it kind of looks like there's a bit more of a rounded buttocks or rounded glutes off to the outside of that glute region. And often also people talk about in fitness modeling and all that kind of stuff, the upper glute, it's a large kind of part to play. The glute med is a bigger part to play in developing that upper glute perspective as well. And that glute med is designed for lateral flexion or abduction. So this kind of movement. Again, I'll hopefully show you guys. So this kind of movement, taking our leg out to the side, or even external rotation. So a bit of a combination of this kind of movement, crab walks where you're resisting crab walks, focusing on really trying to work the outside component of our hips. It's going to get those glutes working and firing really, really well. Really important that we utilize that, and it's really important with hip stabilization as well. So glutes are an incredibly important muscle to me. They are literally the powerhouse of our body, because we rely so heavily on that hip movement and our glute activation to push us and propel us forward. Incredibly important in pretty much all sports that involve running around, whether it be sideways, forward, no matter what. Rotation, they're important, and they're also really helpful in terms of helping out your core stabilizers to help retain and maintain that neutral pelvic position, which therefore affects our back as well. So if you're not training glutes yet, please get into them. I know they cop a lot of slack in terms of the aesthetic side of things, but they are so damn important for your health and performance as well. So get stuck in, utilize your mindset, understand how to actually activate your glutes by understanding the way that the actual glutes are working. Get stuck in and enjoy that kind of exercise. I hope that's helped with you guys today. It's certainly a point or a muscle group that I'm passionate about because of the effects it have on everything. So really get stuck in. If you have any questions, obviously feel free to shoot them through. But until next time, my friends, I hope that helps and you have a wonderful weekend, and I will catch up with you guys just next week. Take care and look after yourselves.